Anagrelide Hcl is a medication that is used to treat a specific blood disorder called thrombocythemia, which occurs when the bone marrow produces an excessive amount of platelets. Platelets are blood cells that help the body form blood clots. Having too many platelets can lead to circulation issues, including blood clotting and bleeding problems. This medication works by decreasing the number of platelets in the bloodstream, helping to prevent these issues. It is important to take Anagrelide Hcl according to your doctor's instructions and to discuss any concerns or questions with them. The daily dosage and optimal timing for taking this medication will depend on your individual condition and medical history. Before you start taking Anagrelide Hcl, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. You can take this medication by mouth with or without food, as directed by your doctor, usually 2 or 4 times a day. Children or people with liver problems may start out by taking only 1 dose each day. Your doctor will adjust your dose, usually once a week, to find the best dose for you that keeps your blood counts closer to normal. The dosage is based on your medical condition and response to treatment. It's important to use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Even if you feel well, keep taking this medication. People with high platelets may not feel sick. Do not stop taking this medication without consulting your doctor, as stopping Anagrelide will cause your platelets to go back up. Your doctor will check your blood counts regularly to monitor your progress and adjust your dose. Some common side effects of Anagrelide Hcl include headache, diarrhea, weakness, nausea, gas, loss of appetite, and dizziness. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, it is recommended to get up slowly when rising from a sitting or lying position. It is important to remember that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. You should notify your doctor immediately if you experience any serious side effects, including unusual bleeding or bruising, black stools, swelling of the ankles or feet, rapid or difficult breathing, stomach or abdominal pain, unusual tiredness, signs of kidney problems, or vomit that looks like coffee grounds. Seek medical help right away if you have any very serious side effects, such as chest, jaw, or left arm pain, confusion or mental changes, severe dizziness, fainting, fast, irregular, or pounding heartbeat, seizures, trouble speaking, vision changes, or weakness on one side of the body. While a serious allergic reaction to this drug is rare, it is important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed, it is important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before taking Anagrelide, make sure to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's important to also discuss your medical history, especially if you have any heart, lung, kidney, or liver problems. Anagrelide may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid activities that require alertness, such as driving or using machinery, until you can do them safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is also important. This medication may also affect the heart rhythm, which can lead to serious symptoms that need immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that can cause heart rhythm issues. It's important to discuss all the medications you are taking and any existing heart conditions with your doctor. Low levels of potassium or magnesium in the blood can also increase the risk of heart rhythm issues. Discuss any concerns about your potassium or magnesium levels with your doctor, especially if you are taking certain medications or have conditions that may affect these levels. It's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before having surgery. For older adults, there may be increased sensitivity to the side effects of this drug, especially heart rhythm issues. If you are pregnant, discuss the risks and benefits of using this medication with your doctor. It is also recommended to avoid breastfeeding while using this medication and for 1 week after stopping it, due to potential risks to the infant. Always consult your doctor before making any decisions about your medication during pregnancy or breastfeeding. It's important to be aware of potential drug interactions with Anagrelide Hcl, as they can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Anagrelide Hcl include other drugs that can cause bleeding or bruising, such as antiplatelet drugs and blood thinners. It's important to only take aspirin if your doctor approves of it, as it can increase the risk of bleeding when used with Anagrelide. However, if your doctor has directed you to take low-dose aspirin for specific reasons, you should continue taking it unless your doctor instructs you otherwise. Be sure to discuss the risks and benefits with your doctor or pharmacist. Additionally, many drugs besides Anagrelide can affect the heart rhythm, including certain medications like amiodarone, chloroquine, and clarithromycin. Be sure to discuss any concerns about potential drug interactions with your doctor or pharmacist to ensure the safe and effective use of Anagrelide Hcl. If you or someone else has taken too much Anagrelide Hcl and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical assistance. In the U.S., you can call the local Poison Control Center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of an Anagrelide Hcl overdose may include unusual bleeding or bruising, rapid heartbeat, and vomiting. If any of these symptoms occur, it's crucial to seek medical help right away. It is important not to share this medication with others. Before starting and during the use of this medication, it is necessary to undergo lab and/or medical tests such as a heart exam, EKG, complete blood counts, and kidney/liver function tests. It is important to keep all medical and lab appointments and consult your doctor for more details. As for the optimal timing and dosage, it is best to follow your doctor's guidance on when and how to take this medication, as well as any potential benefits it may provide for your specific condition. If you forget to take a dose of Anagrelide Hcl, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule for this medication to work effectively. Remember to take it consistently every day. Make sure to store Anagrelide Hcl at room temperature, away from light and moisture. Keep it out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless you are told to do so. When it expires or is no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.